Hi guys, Dr. Margolin. We got two questions. One I found very interesting. It's a question about stress management, anxiety, and depression management at home or without prescription from a doctor. We all know that there is a big increase in these problems during the current pandemic. At the same time, resources for behavioral health, psychology, and mental health are limited, especially in the areas like ours. And the question is what you can do at home to manage these problems.
Hi, my name is Anna White, and I've been coming to Dr. Margolin's for over a year now, and I am very pleased with all the pain management that I get. I love the staff, love Dr. Margolin.
My name is Stephen Gill. I've been coming here for a couple of years. I'm very satisfied with the doctor and everything he's doing for me. Thank you.
Hi, my name is Diane Walker. I've been coming to the pain clinic for about 2 years, and it has really helped with the pain in my lower back and hip.
Hi, I'm Pam Nixon, and I have had joint and bone pain for at least 2 years, if not longer. And I started coming to Dr. Mongolian, and he's helped me tremendously. I feel so much better since I've been coming here, and I would recommend him to anyone.
Hi, I'm Kathleen Hagedorn. I've been coming to Dr. Margolin since 2011. He has helped me tremendously with different pain problems that I've had, and I am thankful that I found him.
All right, I would like to say a few words about something called CBT. That's one of the most efficacious treatment approach, at least to anxiety and depression that are mild and related to chronic pain or stress, but not necessarily only related to chronic pain, any mild anxiety and depression. It's built on an interesting idea. It's called Cbt Triangle. I modified it and I simplified it. So you can find it much more sophisticated, but just want to communicate the idea. There is a relationship between our thought, trigger, something that happens outside us that triggers us to think or behave a certain way, and behavior. Behavior, thought or cognition it's called, and trigger, something outside. So many people, when they're anxious or depressed, they want to change their thoughts. However, it's very difficult. It's not always possible. You can take medications, you can talk to therapists, but if you're stuck, you don't have access, you don't have time, it's not working out, what can you do? You can actually change the other two components. You can change your behavior, right? For example, if you force yourself to exercise and you have the right exercise program, it would be much more difficult for your mind to keep depressed thoughts. It will just shake you up. If you go to nature, if you change environment, if you start jogging, you change your behavior, or you switch to better meal plan. You eat healthy food, you take supplements like turmeric, St. John's wort, maybe valerian root, so on. You change something in the behavior. It will change your thought, and you will be less reactive to triggers. Also, you can change your triggers. For example, if you're scared of dogs, don't go around dogs or expose yourself gradually to them. Change the triggers as much as you can, and that will change your thoughts. This is an idea, this is in a nutshell, and in the last part of this video, I'll give you some practical advice on what you can do at home without prescription. All right, in this part of the video, we're going to go about some practical down-to-earth ideas based on this CBT principle we discussed on what you can do at home. First, there was an interesting study, and I think it started in Africa, where the access to mental health is even less than any place at least in the United States that I'm familiar with. What can you do? They actually called it grandmother therapy. What they meant is that when you take people, usually retired people or typical stereotype grandmother, but it could be grandfather, it could be anyone, and you train them to compassionately listen to another person, even though they're not psychologists, but they're compassionate, they're patient, they listen, they don't talk, they listen, they let other person talk, they acknowledge what is being said. Sometimes when there is nothing to say, you don't know what to say, if you acknowledge, you briefly repeat, you say you are very anxious because of corona crisis. You say you're depressed because you lost your job and you're concerned about your mortgage or something like that. You repeat brief statement, you show empathy and maybe even sympathy, depends on the context. And or you know how to provide some insight, like, oh, nobody loves me. Well, so you feel nobody loves you? Yes. So let's look at it. How about your parents? How about your siblings? Do you have pets? Do you have friends? So somebody always likes you elsewhere. So you can destroy this nobody concept with an insight. Okay. Then secondly, we talked about exercise. Now, obviously, exercise outside or aerobic exercise or kinesthetic exercise or weights or push-ups, pull-ups, that type of stuff is very good for boosting up your mood if it's done on a regular basis and done correctly. But let's say you're stuck in a small apartment and you don't have any ability to do that. In that case, isometric exercise that we actually recommend for chronic pain, like planks, is also pretty good. And it also has effect on your cognition. Interestingly, a lot of isometric planks, very similar to yoga poses. Meal choices. Well, watch previous videos about sugar, about processed food, dairy, basically low inflammatory diet is good for your mood and cognition. Again, turmeric, I want to mention, it has some antidepressive properties. It can, there was a study, it actually can work almost like Prozac with less side effects. Other option, ashwagandha. We may make a video about it. It's an Indian herb known for centuries. Ashwagandha is from Sanskrit. And if you can access it, modulates your stress response. You need to take it for a while. Valerian root, it's a good, I would quotation mark, sedative. Primarily when you need to calm down immediately. St. John wort may work for mild depression. Again, run it by your doctor. Don't start taking supplements without discussing that with your doctor. And there are others. And the last point is good network, good support group. As we discussed in this grandmother therapy idea, just talking out to somebody else can help, primarily if this person is trained, but any compassionate person can help you. Group therapy, when you're in touch with other people who have similar problem, can help. Having a pet, right? You know that now insurances pay for service dogs, not only for blind people, but people with anxiety and depression. Again, the right type of dog for your needs, your personality, takes some time, if possible trained, or even just right personality click can make a difference. And in general, it's all of the above, right? So if you do all the above, and I undoubtedly there are other methods, so you can go much deeper in each avenue that I suggested, you can stabilize mild anxiety and depression. And the last point, you need to know when you cannot do it without prescription from a doctor. If a person has diagnosis of major depression, a person was hospitalized in a mental institution, he was treated with prescription medications in the past and currently taking them. He obviously, if he has suicidal, homicidal ideations, it's not the case. He definitely need to find a doctor, go to the nearest emergency room. And the last point, I'm neutral of regular antidepressants, SSRIs, SNRIs. They definitely can do a good job when indicated. In our practice of pain management, we have strong concern about benzodiazepines, sedatives, clonazepam, alprazolam, and so on, Xanax, Klonopin, and so on, for two reasons. First, most studies do not advocate use of these medications for a long period of time. There are better medications. They can, quotation mark, hijack, or they can have impact on your brain. And they have terrible interactions with other sedatives, especially with opioid medication. So you want to avoid this medication at all costs if possible. I think that gave like an overview that you can take to the next step. And thank you again for this question. Thank you for supporting our channel. And I hope that the situation will get better. We'll all have less stress and anxiety. And I hope everybody is well and healthy. Yeah.